Okay, welcome to another session of Pulp Nonfiction. Today I have with me from Hong Kong, Heman Tsang. Wait, hang on. Ugh, okay. Welcome to another session of Pulp Nonfiction. Today I have with me from Hong Kong, Heman Tsang. And I believe you graduated from the University of Toronto in 1997 with Dr. Lena Young. That's our connection, you and I. You worked in Toronto for a couple years, and then you returned to Hong Kong in 2000, and you've been working there as a general dentist since then. And yeah, if you can speak a little bit to that, and then we'll get rolling on to some of the information you can share with us as to how the COVID pandemic has affected you and Hong Kong in general.
Okay, thank you for your introduction. Hi,
Yes.
everyone. I am Dr. Heman Tsang, and I'm going to share with you what happened here in Hong Kong. As you know, the China started to have cases in late December, but it's really in mid-January things are escalating. So the situation in Hong Kong at the moment, we have 800 plus cases. In fact, the confirmed cases. But at that time, the first wave, the peak is at 400, around 300 to 400. So we are now seeing the second wave, and I'm going to quickly talk about how we get from A first wave and then the B first and second wave, because that might have some implication to your situation, because nobody knows who is infected, who is the carrier, and what's going on. So going back to January, so things are, I practice normally. In January, I don't take any special precaution. I thought it's one of those viral or influenza. It will come and go. It seems like the mortality rate is not high, but numbers are quickly going up. So at that time, it's during Chinese New Year, end of January. So basically, the whole city kind of shut down. We are in our holiday mood. People are traveling. Locals are traveling. We like to travel, and I did travel. And then when we return, the number doesn't seem right. So you see, China are extending the holiday for instead of a week, 2 weeks. So things get a lot more serious. They have lockdown, and now Hong Kong are following suit. So the lockdown period, since we rely on China to supply everything in a way, because there are hardly any manufacturing or domestic. We don't have our own crops, so we will be starved to death if they don't give us food. So there are railway, there are airplane, and there are roads to connect to Hong Kong. So these are the main routes people transport from China to Hong Kong, and nobody take it very seriously. So Wuhan, a lot of citizens are traveling throughout the world. It's one of the most well-connected city in China. It's in the middle. It's in the middle of the infrastructure, so everyone comes in and go in and out Wuhan. So this is then the numbers start to go up. So what did the government do at that time? They start to take measures and already suspending non-essential government services afterwards, extending school holiday for 2 weeks, another 2 weeks, and then 1 month, and now I don't know. So all the kids stays in school, all the school system shut down. In the beginning, most of the non-essential government services are all shut down. Same with the private sector, they follow government advice. Many of them reduce office hour or start to work from home. So these contingency plan was there during SARS. So they reactivated. It seems like they flow back in pretty well this time. So that first wave is all imported cases from China, and then the numbers going up slowly. So, but we are very concerned. We have leaders who still working at this time, who works at SARS during that time. So they make the call. They said we need to close our border. You can eventually see the direct railway from Wuhan stop first, then the roads for leisure travel, you can't do it unless it's business, and even airplane, everything is shut down. So we isolate, quarantine Hong Kong ourselves. So this is the first wave. And during that time, people you can see on the video fighting for masks, calling overseas for help, everyone shipping their masks into Hong Kong. You see videos that people are buying a lot of toilet paper, rice, things similar to what you see in your homeland now. So it's quite chaotic because people are panic, and this panic buying is irrational, but you got to understand when you fight for survival, everyone will do it for their family. Mm-hmm. So now situations are a lot calmer. I'll defer that later on. So this is the pattern. So numbers are going up every week we see. So I'm going to correlate this part with our dentistry. So in fact, at that moment, everyone is scared. Even though I'm scared, I don't know what to do. But seriously, if you are healthy, you won't go out. If you are unhealthy, you call to go to the hospital. You don't know you're healthy, you just stay home. So everybody, it's like a game, the silent killer, who's gonna, they need to do something. They have a time life of 2 weeks. This is what the worldwide everybody say, okay, 2 weeks, then we should know who are the infected. But there are cases that they are longer shedding. Some people don't have symptoms until they are in the 30 days or even 40-something days, so I don't know. But 2 weeks seems to be the WHO advice so far. So during this suspension period, the 2 weeks time, my office don't have much patient. So nobody comes in, I go home very early, hardly provide any service, but I'll cover that later on. So these are realistically, this is what you're gonna see is if they're gonna let you go back to your normal life, resume minimal activities. You are a healthcare provider, you need to stand by to help people. So you don't expect anybody to come in. So if they have fever, you will go. They know they shouldn't see a dentist. It's those asymptomatic carrier who think they are healthy, then you thought they're healthy, so that's the problem arise. So let's go back again. So first wave is gone. The first wave, 400 cases, seems to be quiet down. But then this period, how long does it stay? It stays about around 4 to 6 weeks. That we see declining number in 4, declining number in the 5th week, declining number in the 6th week. But during this window period, unfortunately, the other part of the world has not been so serious. And I told you, people go out during Chinese New Year. So they go out, you could, because of the epicenter is from there, you got many cluster going on. And Hong Kong citizen, after the Chinese New Year, they return to home. So that usually is around 2 weeks to 3 weeks after the. So we have a second wave hit us when they come back.
Yeah.
Okay? And also overseas, there are more problems. And also Hong Kong, a lot of children go overseas for boarding school.
Yeah.
They have to return home. And once they return home, they back. And now that's why our second wave is coming up.
Now, when those people returned home, did they have the rules where they had to self-quarantine?
Yes.
Self-isolate? For 2 weeks?
For 2 weeks.
Okay, so when they returned, they self-isolated. Yeah.
Actually, they have tag on them that they supposed to report every day what the activities, and there are apps on phone that they need to follow certain instructions. So the government is kind of monitoring them, but it's more or less the honest system. If they want to break it and go out, they could. Yeah. So yeah, that's the second wave, and that's what we are dealing with. Is our second wave, which is doubling the first wave. What happened is about more than half to 75% are all imported cases. Cases that they make overseas travel earlier, cases that the student borders are coming back home, and that's the second wave. So this is what we're dealing with. So that's the pattern that I see so far in Hong Kong. So
can you give me just 1 second? Sorry, just 1 second.
Sure.
1,000 apologies. My son came home and started banging on the piano, and I don't know if you could hear it, but I was like, oh, and I was trying to text my wife, shut the door, but no one was listening to me. I was like, oh, it's
No
getting really
problem.
noisy. Okay.
Okay.
So I was you had a bit
Okay.
of a breath there. It's sorry, I was distracted because I'm like, turn off the noise. So you have my
All
full
right.
attention now.
Okay.
Okay, so
Uh,
you were
let's
chatting
let's
about
go
the
back.
returnees, right?
Yeah, the returnees. So
Okay.
those comprise of about 50 to 75% of the cases. So
Yes.
the remaining 25% of the cases, these are my guess. It's not published. It's just my ballpark figure.
Yes.
Don't take it too serious.
Yeah.
But the remaining 20, 30, or even 40% of the new cases are from domestic. So how do they get it? For example, you hospitalize people, you don't know, you don't put them in ICU right away. So you put in a isolation ward, uh, but you don't know they probably are symptomatic. They may have ongoing fever, but there are personnel going in and out. So you get cross contamination to healthy one, and then they waited out maybe another 2 weeks to have problem. So these are isolated cases. I don't think it's very common. And also when you lock down people, I advise them not to go out. There's another cluster of infected patients coming out, namely in pubs, because people need to go out and have entertainment. They go out and drink. Entertainment business, for example, karaoke. Um, they go to fitness gym. So we have clustered in the second wave, which is fitness center, pub and restaurant, and even entertainment district. Okay,
And nail
so
salons and facial places too, right?
nail salon and facial places, those also been they thought it's going to be a high risk. Okay, they have to do something. So what happened is they haven't got a facial and nail salon. They don't have any cases yet, but
Oh, I see. Okay.
they are very worried because you thought you are not going to be too close to them,
Yeah.
right? But in fact, you are quite close, and you don't know who is the asymptomatic carrier. But when you have a drink, you get loosened up. Your hygiene may not be as close, and you speak, and that's what they got contaminated. And there's a ban in Hong Kong. There's a restaurant chain. They hire a band of maybe 5, 6 live band musician, and they travel 4, 5 different places. And that band, everyone get infected. And the
Oh.
restaurant, they all travel, so they trace back to the band, and that's why they implement a new system is 14 days shut down all restaurant and not well they shut down at nighttime, okay,
Mm-hmm.
but the pubs everything shut down for 14
Mm-hmm.
days. So
Mm-hmm.
they really want to stop people from going out. So there are a lot of noises coming out from the industry as a we can survive like this, you know.
Yeah, you're hurting. Yeah.
So this is ongoing now, and the shutdown is 1 week now. So there's a couple more days to go and see what happened, whether the numbers start to go down and flatten the curve, and then everyone can go back a little bit better. But overall, first wave, second wave, Hong Kong never shut down.
Yeah.
We maintain the economic activities, but it's kind of like the government lets you say, okay, you can probably should slow down. They don't stop you, but everybody are self-disciplined. They know they shouldn't do this and that. So in the first 2, 3 weeks, like what you're going through, basically everyone is scared. They hide and they just don't go out. So when I go out on the street, which you can, no one will give you a ticket at that time, and there's no traffic. There's less than 50% people in the public transit system. So it's no people, like unnecessary travel. There is nothing. So, but after 3, 4 weeks, numbers are going down. People getting customary to wash hands, doing hygiene, and they don't get infected. They know I'm healthy. I know these are things that I've been doing, and I seems to be okay. So they start to loosen up and going out. So those are another second wave that will hit you. So stay vigilant all the time, as much as you can, as long as you can.
Mm-hmm.
Especially the kids, they are the most difficult to teach, and you need to protect them by, keep them busy at home.
Yeah.
Luckily, you have a big home, so that's not a problem. They should be self-sufficient.
Yeah, the average home in Hong Kong is how many, like, it's not that large, right? Because most people are in
Oh,
apartments.
it's 700, I think.
Yeah.
That consider luxury. That's a 2-bedroom, but yeah, it's we are very crowded. So
Yeah.
that's our spread could be a lot more faster than you, since you are more apart. We live in very close space, just like New York. Why New York
Yes.
lose control is like too crowded,
Yeah.
and you just don't have enough. You don't know who got what. Yeah.
And I want to give you a word of warning. The divorce rate in Wuhan has gone up because the people had to stay at home together. So be nice to your wife.
Yeah. So there are so many.
Or this could be the most expensive pandemic anyone's encountered.
Yep.
Yeah. Yeah. So
Oh,
yeah, that's interesting. So you're in the midst of the second wave, and do you think that they will slowly ease off the restrictions? Because I imagine if they ease off them quick, you could have a quick.
they are tightening even more tight now. Okay,
Okay.
tightening up the restriction. We are not allowed to go out to do any activities for more than 4 people.
Mm-hmm.
Okay, so if you have 5 people, 6 people want to go out have dinner, which you can, okay, but you cannot. You have to break down into 2 tables, 1, 3 and 3, or 2 and 4. It's up to you. Each table can only have 4 people sitting. You
Mm-hmm.
cannot do well. All events are closed, so those any number more than any event more than 4 people you cannot do.
Yeah.
Otherwise, you would be fined.
Yeah.
They will fine you with a ticket,
Yeah.
and couple. I think it's 2,000 Hong Kong for a violation of gathering.
Yeah.
Yeah, that's what they do now. But it's just want you not to social distancing. Make sure since it's in the middle of second wave, we don't know whether the number is gonna pop or not. So let's maintain it. So everyone has to pay the price. Yeah.
Yeah. Yeah.
Okay, but I think you can see China is loosening up. They are letting go a lot of stuff. I'm sure one day everyone will. So we just have to bite the bullet, I guess.
So the trade is remaining open with China, but the people aren't crossing per se. Very minimal with the borders.
No recreational travel.
Yeah.
No.
Yeah. Strictly business and goods.
Yeah,
Yeah.
strictly in and out. And I think they are going to do tests on the driver as well.
Yeah.
But I heard it's coming up. So they just want to make sure nobody brings anything in. So complete lockdown in a way.
Yeah. Yeah. And organized dentistry in Hong Kong. Have you had much direction from them?
Okay, let's go to dentistry side. Since
Oh yeah, yeah.
here.
Sorry. Yeah. Is there any
okay.
other? Is there any other
No,
social
that's
things? We covered them pretty good.
Yeah, pretty good. And restaurant business. Let me go back because I just lost one point. Each table to table, we have to keep minimum 1.5 meters apart. So let's say a restaurant used to sit everyone next to each other, no longer. Each table of 4, you have to have a radius of 1.5 meter.
Oh wow.
So which means your restaurant are basically cut the capacity into half or even more.
Yeah.
So that's what we are doing so far. So they let people go out, but you cannot. It's kind of discouraging you to go out, but you can still go out.
And
so it's not very.
And it probably won't. It doesn't feel like Hong Kong at all because there's no one near you. Like you're used to it being crowded, and that the streets are a bit empty, and the restaurants, juggles of space, right? Yeah, must be quite odd feeling.
So, I just take a photo this morning.
Yes.
Hold on. At Starbucks, I don't know if you can see it.
Oh yes. Yeah.
So they still keep the table in there. That's
they got the white tape on there so that no one can sit there.
So no one can sit there. So this is what we are doing in every single restaurant. They are closing up the other table next to you, so you can have your own zone.
Yeah.
Okay,
Ah.
dentistry. Let's go to dentistry.
Oh, actually, before we get to the dentistry part, you sent that very interesting. Who do I want to be during COVID-19? That drawing. That's graphic.
Yeah, I
Pardon
sent
me.
you this one.
Yeah, this is excellent.
I got it from my my class 97 class. One of my classmates sent to the group, and I read it, and I find it's very inspiring. So this circle of mental fitness, like you have to break through and break through. So I think we can share this with the group here, and everyone can take a look and try to grow out of the fear, and that's what it means. Yeah.
I practice quietude. That's brilliant. Instead of attitude, I practice quietude, patience, and relationships and creativity. It's really good because you can almost do that for, Hong Kong and where you live too, because you definitely had the fear zone when everyone was jumping over each other for masks and such things. And Hong Kong's gone a little bit more into the learning zone, and hopefully the growth zone is soon to come for everybody.
Yeah, when you are emotionally stressed, you can have emotion over your friend, your family, and suddenly you lose it, and you don't know why. So you have to keep calm. Yeah, do as much as you can, and understand each other's value and accept them. Yeah. So make sure that hatred.
Yeah. So in your 4-bedroom, 3,000 square foot flat in Hong Kong, because you're Mr. Big in Hong Kong. No. So
if I have that, I probably don't need to work.
What are you doing at home? What is your family doing to endure?
Okay, my family, the kids stay home. Basically, virtual classroom. Okay, the school start to put out virtual. I don't see them going back to school anymore. It's already April, so a couple more months to go. And also, the education board already told us if the kids are going back to school, definitely university first, secondary, and then primary, and kindergarten probably the last in the line. So if you figure that out, if your kids are really small, think of how you're gonna prepare them at home. I don't think they ever need to go back to school before the summer.
Yes.
Yeah. So the schools start to implement a lot of e-learning. So they basically do whatever they want. I try to keep them moving in the house, but Hong Kong is very small. So keep exercising at your backyard or something, and let them do whatever they like to. So maybe it's a good break. Consider it sabbatical.
No, absolutely.
And my wife, I have a working wife. She still go to work, but they have a strategy. She only go to 2 days or 3 days a week. So most work from home. Yeah.
Oh, good.
So me, I go to office every day.
Yeah.
But in the beginning, now I'm closing more days down because there's no demand.
Yeah.
So I'm trying to. That's something I want to cover. Is you have to find a strategy to operate. You don't need to operate full hours. Teleconferencing is a good way to connect to patients. For example, WhatsApp calls. If your office do not have a WhatsApp number, maybe it's good to make one and let them know you can call this number, and then someone will look after you. So telemedicine, I guess.
No, absolutely. Yeah, they've relaxed the rules here in British Columbia for us to prescribe medications and diagnose on patients without doing a clinical exam, and try to do as much as we possibly can for dentists and physicians. Do as much telemedicine, teledentistry as you can, and try to avoid bringing the patient in. And they've relaxed some of the rules. Like in the good old days 4 weeks ago, it would have been malpractice for me to prescribe some antibiotics or pain medications to a patient I'd never actually examined. But now, if I get the email from the referring dentist and I speak to the patient on the phone and I have an x-ray from the dentist, I'm okay to prescribe medications. Whereas I'd really be on thin ice 4 weeks ago because it's like, well, they could send you the wrong X-ray, you haven't done your own exam, and this and the other. But well, during the pandemic right now, the balance is that's okay at this point in time, given the major drawbacks of us having face-to-face interaction. Now we're in the midst of our first wave here, so it's you're a little further along than us.
Mhm.
In Hong Kong. Yeah.
But your second wave, I think you probably won't have imported cases because everywhere already has the first wave, so it will be domestic.
Mm-hmm.
So have to keep enduring the social distancing for a little longer,
Mm-hmm.
and buy you more time to eradicate the disease. Hopefully they are right. Last time SARS disappeared when it get warm. I hope Hong Kong will probably get warm in a month or two. So there you go. Hopefully it will give you some indication of temperature, whether it do anything with the viral activities or anything.
Yeah.
So I hope that's the case.
Yes.
Okay. You want me to talk about dentistry, dental?
Yes. Let's chat about you and your office and dentistry.
Okay.
Yeah.
Firstly, I want to make it clear that I do not represent any organization. No. Meaning, I don't want to speak because this is what Hong Kong way. No, it's just my way.
Yes.
After reading anything I know, I learn, and I do it now. So I think it makes sense. But most of things I do now, as you know, ADA came out with a interim guideline early this month. If you can Google it, I just look at it. It basically is similar to what we advocate in Hong Kong by the regulatory body. So you do screening, over the phone screening, before they walk in the door. You do another questionnaire, measure the body temperature. If they're sick, don't let them in. Like all these procedures, basically you can read, and we do exactly the same. So which is essential to screen out the potential cases, because at the end of the day, if we don't have a therapeutic that will cure the sick or a vaccine that able to give us immunity to prevent exaggerated damage to ourselves, there is no cure. So you never will be sure who is the sick one that will get you infected.
The silent killer, right?
The silent killer. So all you can do is you have to believe probability, right? So if you are sick, no way they're going to come in for dentistry. So they go to hospital to save their life first. Mm-hmm. So the one who wants to do dentistry, probably relatively healthy. And it's those asymptomatic cases you want to screen out, but not 100%. But the probability of them is relatively low. You should, but not at the epicenter now. So if you, in my first wave, I try not to work. But after 2 weeks, you know the chance, whatever who got really sick, they should go to hospital. The remaining one should be relatively clean. You have to wear masks, protect yourself at the office and also outside. Okay, in Asia we wear masks most of the time. If we are sick, or at this time you just put it on, you don't know who's sick, better to put a mask on. That's why we rush out to buy masks right away. It's common practice in Japan, it's common practice in Korea. So that's why you see everybody, 99% when you see the photos on the street, everybody's wearing masks. It's just the supply issue, because China shut down, the supply chain is down. There's not enough supply going on, and people rush out and cause social unrest, right? And people will fight for masks, and this is something that you don't want to. Okay, so that's why locking you in quarantine is a good way, and then they can keep producing. Hopefully, supply will catch up. Okay, so first 2 weeks I don't work much. We screen the patient as much as we can, and we try not to operate as much as we can. If we need to, the only area that I'm very, very concerned is aerosol. So try not to touch your high speed, freeway, whatever, try not to produce any aerosol if you are not sure. If you can buy time, not so much paying for cleaning, everything elective, don't do it unless it's pain cases. But pain cases, sometimes some patients are so fearful, they will endure that pain until the pulp is dead. They don't have any more pain. So it's really up to them. But if they really want to come in, you have to see them. So that's what I did. So in the first 2 weeks, not much going on, but I still go in. This is the time you prepare yourself. You need to start counting your supply. Talking about supply, I have supplies now, but those are orders I placed in January. I couldn't order anymore. Nothing in February. The supplier, we don't produce in locally. So the supplier told me, we don't know when we're gonna have shipment. Okay, everything stopped. So this is realistic. On your part, I hope you have local manufacturer that is able to keep replenishing the dental supplies to you. But if they're gonna make any N95, isolation, PPE, they go to hospital first, not for you. So you have to start counting your resources and see how long you can last. So I start counting mine. I'm glad my nurse makes some bold call. She just told me afterwards that I order a lot of things. I hope you don't mind. And big surprise, because she's my almost a manager. She should take care of everything. So she's quite how should I say it? She like to be prepared a lot more than normal, and I'm glad she ordered a lot. So I have enough masks, PPE for maybe I only have about 40, and that's it. So I start counting how many PPE I need. I cannot afford to change masks for every patient, to be serious. I cannot afford to dispose one PPE for a single patient. You're gonna run out. You're not gonna be last for 1 week, and then your office will close down, because if you don't if you can't protect yourself or your staff, forget about providing for patients. So this is realistic. You have to start thinking, counting your supply. How long can you last? If you don't have that supply, you don't see that coming back, say in 2 months or 3 months, how are you going to operate? How are you going to cut down your manpower, your staff, to reduce consumption? That's what I do. Is I ask my nurse not to come, or if they are willing to take no pay leave or take their holiday, take it now. Okay, there's no need for coming in. The department that hit the hardest is the hygiene. So you can expect, if you have a hygiene department, it's basically shut down. There's nobody coming for cleaning. Yeah. So that's so far what I did. So communicate with your staff right now. Think about your strategy, how you reopen, how you're going to protect yourself and your staff before you provide to your patient. And then lay out rules that you want the staff to exercise for you, because they have to do so many times until they get comfortable. You tell them, do this, do this, do this now. They will do it, but they have to prove that I don't get sick when I come to work. I don't get sick, I come to work. So they believe, yes, I can do something. They want to come to work, I think. And they have to get their own safety zone. And that's why you need to implement past practice and make sure they're doing more and more, and make sure every step are being executed the way you want to, and they don't get sick. They know they are safe. When they are safe, they are willing to come into work. But right now, if you ask them to come to work, if they don't want to, I said, okay, it's okay to stay home, because you don't need everybody, but we can take turns. Yeah, that's on the staffing side of how I handle the situation.
Yeah. Oh yeah.
So today is what 2.5 months now.
Yes.
So honestly, I did pick up my high speed. Okay, it's 6
You're
weeks.
amongst friends here. It's okay. Don't worry, Bob. We won't tell anyone your name.
It's okay. Well, there are, in Hong Kong, I think it's just my image.
Yeah.
The dental office are not completely closed. it's at least a good 50% are still open. I don't think I'm the only one touching our high speed.
Mm-hmm.
But when we need to use our high speed and we think, okay, is this a case too risky for me?
Yeah.
You make the call. At the end of the day, you need to decide to do it. So dentistry so far is we have to use high speed. If not, we can work. So either you can retire now, or you need to do something, and then just be careful, I guess, rather than high volume suction. One good point is I asked my nurse to check my high volume suction, because that is a lifesaver. Luckily I destinate one vacuum per operatory. I don't have a central unit. Okay, so I have one vacuum for each operatory. So make sure your high speed is 100%. Make sure your hose is not blocked. Make sure your high speeds are as efficient as possible, because at the end of the high speed, that's going to save you. Yeah, sorry, high volume suction.
Yes. Yes. The high volume to counter the high speed.
The high volume suction is the key. So make sure you check it, the connection, everything is 100%, nothing blocked in the middle, everything got cleaned up, and okay. Face shield, face mask, everything. And also, last word, I don't have N95 anymore.
Yes.
So I'm working on. I have the best one I can get is level 2, but if soon run out, then I will go to level 1.
Yes. Yeah. And with your level 2, you change it at lunch. You wear it in the afternoon. You wear it home. Put it in a Ziploc bag, and then wear it in. Is that right? How do you maximize your safety and use, because you have to be so judicious with your supplies?
Yes. So basically, let's home part. When I go home, I always go home with a mask.
Yeah.
Are we lost on it? Okay. I go home with a clean mask. I don't touch it. Once I go home, number one thing is wash my hand, then take off that clean mask and kind of put it on the side. Don't touch it. Okay. And then the next morning I go home with that clean mask, and I work with that clean mask at least in the morning. Okay. If you find your mask is soiled, you change it right away. If it's not soiled, then you can. Presuming I'm seeing only maybe 1 to 3 patients a day, then I don't touch my mask. I keep it whole day. I throw that away and then go home with a clean mask and come back with that mask. So whether in between I need to commute in Hong Kong through public transit, but if you are driving on your own, then your mask is probably more clean than me. Okay, but another issue about teaching your staff and your family on masks, if you are planning to wear masks, you need to take it on and off multiple times a day. For example, for your children. So make sure teach them which side is outside, which side is inside, because sometimes you have they do make it wrong. Make sure it's adapted well. And also when you undo your mask, there are many YouTube videos you can search, people teaching you how to protect the clean side versus the non-clean side. Use an envelope to put it in a certain way and throw away the envelope, throw away the bags every time. So this is how you keep your mask clean. So yeah, you can search, and there are many ideas outside. So but I try not to touch my mask once I put it on, and just leave it as long as you can.
Yes. Yes.
So count the number of masks you have, and how long, and how many staff you need, and how long you plan to. Presumably, there's no supply in the next 3 months. What are you going to do?
Yes. No, absolutely. Those are great. Words to live by in this short term. Is count the number of masks, minimize your use of masks as much as possible, and if you also minimize your staff too.
Even gloves.
Yes, gloves. Yes.
Why? Is because most of the latex are produced in Malaysia. The air traffic is all shut down. The raw material not being shipped. No one's working in Malaysia. We have a shortage of. My nurse couldn't order extra small for her, so I don't know what's going to happen. So we'll see. So
Yeah.
gloves are the last to hit you. It's the PPE, mask, and then the glove.
Yes. Yeah. And I think you did touch on this, but you did start they did start manufacturing masks in Hong Kong, which is absolutely fantastic.
Yes.
And
Um, we
maybe,
local company
yeah,
buying raw material
yeah.
and produce locally, and I think that's the way to go, because the supply chain is all globalization is too deep, infiltrated everywhere. So once one chain is not working, the lower chain is gonna run out.
Yes, the
So you have
weakest
to,
link. Yes.
yeah.
Yeah.
So
Yeah. And China's still sending you lots and lots of masks and supplies, but they're
I
primarily
think
going to the hospitals.
I don't quote me on that, but I
Yeah.
think that's what happened is
Yeah.
hospital seems to be able to replenish everything to the frontline worker. So they must be doing something.
Yes. It's nice when you have a neighbor that trades with you. That's not always the case. I don't know if you heard about Canada, but we won't get into that. We have a neighbor who's not necessarily trading, but
We'll see.
we
It
shall
might
see.
change this week.
Yes, yes, no, absolutely. Yeah. Well, that's fantastic. I think we've covered all that we had planned on covering today. That's wonderful. I
Yeah.
yeah,
Oh,
it
one more
yes.
issue I want to mention. Maybe you can. I get a few things I want to say. I want to leave you with no answer. Do your own searching on the internet. What's right? What's wrong?
Yes.
First of all, it's all about probability. Uh, your chance of you getting sick is not very high. If a
Mhm.
patient is getting, they won't be seeing you.
Mhm.
If they are asymptomatic, do the search online. Set the viral load is relatively low. Okay,
That's right.
and
Yes. If they're asymptomatic, they're not
we
stuffing
take
off nearly
all
as
the
many viruses.
precaution.
Yeah.
We further yeah, and also do the search on the size of the virus. Okay, to what I understand is the virus is about 0.06 to 0.14 micron.
Oh
That's
wow.
yeah. So they are smaller than 0.3 micron. So the N95 supposed to block 95% of the 0.3. So what happened is N95 really protecting you, even though they are fit tested. So
Mhm.
all the science we know by numbers, but maybe when they do the real in vivo, it's not going to happen. So do the search yourself and see. We can never win this war because the virus is just too small. Nothing will protect you between you and the virus. And yeah, and think of how you're gonna reduce the probability. We study so long, so it's an educated guess. It's a calculated risk for everyone. So
Yes.
think it over. Yeah. And so far, one good news is I don't hear any dental cluster, which is very important worldwide. Maybe a lot of places are shut down, so there cannot be a cluster. But
Mhm.
say in Hong Kong, if I best guess is half of the practice still working, and let's say we have domestic carrier, so we should somehow, if we wait long enough, there will be a dental cluster. So it depends on our technique of universal precaution on what's going to happen. Keep an eye if there's a dental cluster, then you should stop working because nothing, we can't fight this.
Mhm.
So if this is happening, we can't do dentistry anymore with turbine, which means we need to look for ways to control bioaerosol or negative pressure room like a hospital. So it's like on and on and on. We have so many tools, but do we need to throw everything in? Do we, at this time, everyone wants the best, but realistically, you're not going to get it. You're not going to get it. You won't have everything. So
Mhm.
it's going to give us a revolution in dentistry. I don't know how we're going to go from here.
Yeah, there's a new normal, but we don't know what that is yet. And
No.
yeah, it's going to be different. What was normal 5 weeks ago? Well, I guess for you, December. Um, yeah, it's a distant memory now.
Mm-hmm. But
Yeah.
well, we went through SARS, so we did okay.
Yes.
So the virus is gonna keep coming back,
Mm-hmm.
especially. I believe in global warming.
Mm-hmm.
Is I believe human and animals are closer together. They lost their food source. They lost their appetite. You probably see it. The bear are coming in your backyard to find food. Who
Yeah.
knows what will happen? But we
Yes.
need to. Virus is going to hit us, and this is a good exercise, I think. Even though at a cost of some lives, but
Well,
you
thank
know,
God it's not a more deadly virus. You know,
no.
it like at least it's yeah, it could be much worse. Yeah.
Until a vaccine, I don't think anything can be done.
Yes. Yes. No.
So
Absolutely.
be positive. We
Yes.
survive in Hong Kong so far, so do you. So you have a lot more space, which should be a lot better.
Yes. Yeah. Yes. Space is helpful. It's easier to self-isolate when yeah, you have a bit of space, and you're surviving in Hong Kong, so that's a fantastic example. And yeah, people are pulling together, aren't they? You're getting the. I imagine a few weeks ago or in early January, there was probably a bit of resistance to things, and now there's a lot less resistance. Like, yeah, if a new rule comes out, it's like, you know, we should really follow that rule because I guess you had slow adoption of some rules and then paid for it, and you know, eventually people are learning.
Yeah.
Yeah.
So I'm hopeful,
Yes.
optimistic.
There we go. Yes. Well, no, it
It
was
doesn't.
lovely chatting with you, and I think we covered some great information. And yeah, you know, you're gonna be safe. You're a good fellow. Um, and yeah, onwards and upwards.
Thanks for having me. I hope my message could give you some confidence of your career, your loved one, how you protect them, and also, yeah, we can get it over. We can go over with it very soon, I think.
Yes. Yes, no, definitely. So hopefully some warm weather in Hong Kong and things will turn around and yeah, we'll get on top of it too. Well, this is wonderful. Thank you so much. I think that wraps up our session. I'll post the document that you sent us. And you mentioned before that there were some articles that you saw, just one or two that maybe of interest. And I realize some of them might not be in English, and that's okay. It's a global audience, and it just is one or two. Please send me the links. I'll post them up there for people to see, and
Okay.
maybe a couple photos you have of Hong Kong street life. That would be most interesting to see as well. You know,
Sure.
because we're all used to seeing busy Hong Kong. Let's see unbusy Hong Kong.
Okay.
Yeah, yeah.
It,
Well, thank you
yeah.
so much.